Yay Networks.
Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and boy, am I excited. Today, we're going to be talking about rhinoplasty, that is nose job. And as anyone who knows me or follows me knows that it's one of my favorite, if not my favorite procedure to perform. My friends who knew me growing up knew that I was a glutton for punishment. And without a doubt, the most challenging surgery within plastic surgery, at least aesthetics, is the rhinoplasty. So we're going to delve into literally everything you need to know. You want to take notes, pay attention. If you're considering doing a rhinoplasty, this is everything you need to know. So I'm here today with my producer and confidant, Maria. Welcome.
Hi there. Welcome, everyone.
Maria, I would say about 40% of my practice is noses. That's a lot. One of the things about noses that's interesting and why I think it's such a fascinating topic is the following. Number one, the nose is smack dab in the middle of your face. So it's one of those things that if you do a bad job or a good job, it makes so much more of a difference than if you have a botched breast dog or a weird tummy tuck. You can hide those things. You can't hide your nose. Furthermore, it makes such a big difference in the way you look. So, you know, if you go and you do your eyelids tomorrow and you're 55 and your eyelids are done incredibly well, yes, you will look better, unarguably, but nowhere near as good as you will look if you have a terrible nose and you do an amazing nose job. It's exponentially more powerful. And so for that reason, I just love noses. But as you know, anything that's that powerful in the good is that powerful in the bad. So equally so, you know, if you do a terrible rhinoplasty, it's horrible. I mean, we know celebrities, we all have friends. We knew that girl or guy in high school. We all have seen the terrible nose jobs. So for that reason, we're going to teach you everything you need to know. And unlike breast dogs, rhinoplasty isn't something you dabble in. As a surgeon, if you go on people's galleries and you start Googling doctors, you'll see that pretty much every guy or gal who does cosmetic surgery says they do a breast dogs. Seldom you're going to see anyone who doesn't do breast dogs. Same is true of liposuction. But I would say really only about 25% of plastic surgeons, and we've already had episodes on who's a plastic surgeon, who's a cosmetic surgeon, who's a facial plastics. Let's just call them all plastic surgeons for the time being. Only 25% of them really do noses. And the reason is the nose will kill you as a doctor. It'll just destroy you. If you don't know what you're doing, patients will come back, they'll complain. The littlest changes make a big difference. So anyway, so that's my intro. And first thing I do, anybody comes into my office, the first thing I do is I tell them, why are you here? What bothers you about your nose? And 9 out of 10 patients will say the following things. Well, my nose is just kind of big. It's just big for my face. I don't think it really matches the rest of my features. I think it's like out of balance. I just wish it were a little bit smaller, maybe slightly more refined. I just definitely want something natural, something that just overall looks like it belongs to me. I kind of don't want anyone to know. All of what I just said is nonsense. It's just complete, total nonsense. Because what you just described is a bunch of subjective, descriptive entities about your nose. Smaller, pretty, feminine, natural. What does that mean? Nobody even knows what that means. You and I know there are people with the most horrific looking noses walking around and they swear to God their nose looks natural. So you never, ever want to ask a surgeon to do anything that requires interpretation, because your surgeon may think he or she is doing an incredible job. I mean, they're so excited about the result and you may be horrified. So don't use the word natural or balance. All that stuff, it doesn't mean anything. You want to talk about your nose objectively. Objectively means, yeah, I got this huge hump on my nose. I want the hump gone. My tip is bulbous and fat and it doesn't have a tip. I want that improved. My nose is kind of droopy. It kind of, when I smile, it goes to the ground. It looks weird. It looks like a crow. I want it lifted. My nostrils are way too far apart. I want them narrowed. There are categorical, specific things that make a nose look pretty
or balanced,
or something look balanced, and some things that not. So that's really important. I can't underscore that so much, because you'll go into a clinic and see a doctor and you'll say all these things that are like just general, and the doctor will be like, got it. Totally understand what you're saying. Something subtle, supernatural, balanced. You'll get all excited. Oh my God, this doctor totally gets me. And then you'll wake up from anesthesia and you'll be horrified because you just guys missed the boat. All right. So then first thing I do is I start asking questions about your history. And I ask nasal history questions. So did you ever have a fracture? Were you ever in a bar fight? Did you ever get a ball thrown at your nose? Fractures matter. Do you use a bunch of sprays to help you breathe? Oh, yeah, I use Afrin like 3 or 4 times a day to breathe. That's terrible. That means there's a major problem with your nose. Remember, your nose is not just about looking pretty. It's an organ that is meant to function. What's its function?
Breathing.
Breathe.
And it's very important that you breathe accurately, correctly.
Yeah. So you come in and you're like, yeah, I'm fine. My breathing's good. I hate the way it looks. And then you leave and all of a sudden you can't breathe at all. So do not underestimate the importance of breathing. So we ask you if you use sprays. Do you have difficulty breathing? When is it? Is it during exercise? Is it at night? Have you ever had anything done to your nose? I can't tell you the number of people that I like push them on this and like, oh yeah, that's right. When I was 16, this thing where they helped me breathe, this like, septoplasty thing. Like, oh my God, that's so important. Don't minimize any of these things. Like if anyone's ever touched your nose, filler, Botox, surgery, septum, sinus, you got to tell your doctor. All those things matter. After I'm done doing all those things, then I ask those questions. Oh yeah, by the way, if you have pets make a huge difference. People come in, they're like, I don't like the way my nose looks. And by the way, I can't breathe at all. I'm always congested. And then I push and I said, okay, well, do you have any pets? Oh, I have 6 cats, 2 chickens, a guinea pig, and a rabbit.
That's why
they're all hypoallergenic, and I'm not allergic. Yes, you are. You have like you're like a farm. Of course, you can't breathe. There's no surgery that's going to get rid of all that fur that's causing you allergies. So don't underestimate the effects of your pets. They're awesome. They're cute. They're loving, but they will cause you to be able to. They will reduce your breathing. There's just no one in the world who it's not this hypoallergenic garbage that people are saying. Dogs, cats, animals have dander. They have all this crap that's on their body, as clean as you think they are, just like humans, and that stuff goes in your lungs. Mm-hmm. So then we shift gears and then we get into the exam. So this idea of having a doctor in Miami just whimsically tell you off of 2 photos that you are or aren't a candidate is tricky. Remember, a third of my patients are from out of state, out of country. So you can absolutely get an idea, but ultimately you should never, ever be operated on someone who hasn't examined your nose in advance, inside your nose, feel your skin, et cetera. So all the patients that we see from, I don't know, wherever, Dubai, Netherlands, et cetera, we always see them for examination before the surgery the day before.
But you will have like an initial conversation with them, let's say virtual consult, right?
Yeah, of course. So they send in their photos and I'm like, oh, wow, look at that nose. Or that nose doesn't look so bad. We do all these things. We do the Skype or FaceTime. And then they don't just show up and then I meet them in the operating room.
Right.
There was a girl I met from Turkey. So I do my best. I try to figure it out. She shows up and, wasn't what we had discussed. And I actually couldn't operate on her. It's incredibly seldom, but I'm not going to operate on you because you flew here. I'm going to operate on you because you're going to do great. So let's get into the exam part. So the first thing, the most important thing about a nose, believe it or not, is the things you can't fix. So what can't you fix? You can't fix skin. Okay. So a rhinoplasty, I don't care who you go to, what technique they use. I don't care if they're world renowned. They all, the basics are all the same. Your surgeon is going to lift up the skin of your nose and expose the bone and the cartilage. And they're going to rearrange it. They're going to make it look really pretty and balanced and natural and all those things. And then they're going to take the skin and then lay it back down like a carpet on top of that structure. And then they're going to sit around and wait. And what are they waiting for? They're waiting for the swelling. They're waiting for the swelling to go away and for that structure that they created to show through the skin. So when you come in and you have thin skin, I'm talking, you can see the cartilage underneath your skin. You know that after surgery, you're going to have super visible cartilage. And that means that you cannot leave even the slightest irregularity because it'll show up. Initially, you'll be fine. It'll be swollen. And at like 8 months, you'll be like, what the hell is this thing over here? And that little speckule of bone is visible through your skin. Conversely, if you come in with super thick, oily, sebaceous, fatty skin, the surgeon's going to do the same surgery he or she did on the thin skin person that can see everything. You're going to wait 18 months and then you're going to call and be like, hey, I'm really disappointed. What are you disappointed about? Oh, like I can't see any definition. My tip is still kind of broad and bulbous. I thought you were going to make it like really refined. I did. I made it refined. I made it really refined, but your thick skin ate it up. It's like putting, I don't know, like a quarter under a carpet. You're never going to see it. So that is where ethnic rhinoplasty comes in. There's all this talk online, ethnic rhinoplasty. Oh, I'm an ethnic specialist. What the hell does that mean? It just means that as an ethnic person, you have certain features that a non-ethnic so-called Caucasian doesn't have. And one of the biggest elements is having thick skin. And there are unique ways to do rhinoplasties for thick skin people and unique ways to do it for thin skin people. The point being, skin matters. And you can't go in with thick skin and ask them to make it thin, and you can't do the reverse. So skin is super important. Latinos, African Americans, Koreans, certain people have really thick skin, and so their surgeries require a different approach. The other thing we look at that isn't exactly nose related is the jaw, the chin. Everyone who knows me knows I love chinogs. And I love chinogs because you have a big nose and a small chin. You do a rhinoplasty and a chinog, and all of a sudden you're a supermodel. It just is the way that it is. And if you go online, you'll see that somehow there's a section on my gallery that's nose and chin. You don't see a section with nose and ears, nose and eyelids, nose and breast dog. It's nose and chin because on your profile, which a lot of people come in like, I don't mind my front. It's pretty good. I just hate my profile. Well, the reason you hate your profile is not just because you have a big nose. It's because you have a weak chin, and we can do whatever we want with your nose. Your nose looks spectacular. You're still going to come back and like, I don't know. Something just doesn't look right. It still kind of looks big. Well, yeah, it's because you have no jaw. So chinogs are critical with noses. They're sort of related. And so you definitely want to make sure that you're aware or your surgeon helps you with that. The next question is this whole concept you're going to read online all over the place. Open, close, open, close. That's like anybody who knows like beer commercials. It's like tastes great, less filling. You know what I mean? It's just, yeah. So open and close is nothing more than just a bunch of online BS. The close technique means that your surgeon makes 2 incisions inside the nostril. And the open technique means your surgeon makes 2 incisions inside your nostril and then 1 across the base of your nose, the little thin part. And that's the difference. The closed part you do through the 2 openings. And the open part, open surgery, you literally lift up the skin like a hood of a car and open the nose. I do all of my cases open. It doesn't matter. You hear me? It doesn't matter. The only thing that matters, pay close attention, is that you go online and you look at the surgeon and you look at 50, 60, 70, 100 photos, not 6, not 7, 100 photos. And then if you love the work of a surgeon, you call the office and then you find out that they go through the earlobe to get the nose job done. Then you go there and do it through the damn earlobe, because that tells you that the surgeon does his or her work well through whatever technique. Online, surgeons are using the closed approach as this like marketing gig, like, oh, scarless, minimally invasive. That's just nonsense. We're talking about 3 or 4 millimeters of skin, and that area heals incredibly well. For me, I love to see the nose. I open it up. I can measure the cartilage. I have great access. When we get down to the idea of structured rhinoplasty, which I'll explain, I feel like I can do it 100 times better open. Again, it doesn't matter. And so what we'll do I think, let me see. We still have a little bit of time before the break. I'll kind of delve in a little bit here. So those are the kind of key things before we get into your exam. So then what we're going to do is shift gears after we've had this conversation, and then I'm going to start examining you. And so what am I going to examine? We divide the exam into 4 parts. First part is looking at you straight in the mirror. Second part is looking at you on the side or the profile. Third part is what I call the worm's view, which is meaning looking at your nose from the bottom up. And the last part is looking inside your nose. So let's start with the exam from the front. So what are the things that people complain about? Number 1, my nasal bones, my nose is wide. So wide noses from the front it depends on what part is wide. So first part at the top is the bones. The bones are very wide. So we narrow those and we do what's called an osteotomy. And another thing that drives me nuts. I must get an email once a week. Do you break the bones? Because if you break the bones, I don't want to do it. What are you talking about? Who cares if I break the bones? It's irrelevant. It's part of the surgery. What do you mean? It's like telling your haircut guy, if you're going to use any kind of hairspray, I don't want to be in there. Just let him cut your hair. So it doesn't really matter. In order to make the nose look beautiful, you got to do whatever you got to do. Breaking the nose is no different than shaving it, is no different than suturing it. It's just part of the surgery. So if you have wide nasal bones, we narrow it. Then we get to the middle part of your nose. So if you notice and examine yourself, you'll notice your nose has three parts: the bone, the middle part, and the tip. The bone is hard. The tip is usually bulbous and at the bottom. And then the middle part is what we call the middle vault. That's the transition from the nose bone to the tip. That's where you breathe from. And you go online and look at girls like Bella Hadid or anybody else whose nose is fully collapsed. And we'll get to what that means and everyone's worst nightmare. It collapses in certain places. And an area that it collapses is in the middle vault. That's why they can't breathe. So if you have some weakness, we need to support it. Then we get to your tip. Very common issue, right? My tip is fat. It's bulbous. It's ill-defined. It's boxy. They all mean the same thing, which means that your tip, the tip of your nose, doesn't have a relative point. Notice how I said relative? Obviously, the concern is making the little bird beak, a woodpecker nose. That in and of itself is disastrous. But you can definitely refine the nose without removing too much cartilage. And then lastly is the nostrils. And this is, again, part of the ethnic thing, which means that my nostrils flare. They're wide. And when I smile, they always get wider. So this is super tricky, right? Because what happens is the surgery that I talked to you about so far was all done through the nose. This part is the nostrils. It's a totally different animal. And it's called an alar base reduction, which means that your surgeon will cut around your outside of your nostrils, clip some of the excess that's causing flaring, and sew it back together. This is what leads to the Michael Jackson effect if you don't do it right. It is very, very difficult. So listen.
Can I ask you a question? One of the Khloe, is it Khloe Kardashian? The one that has the migraine headaches? She just did something to her nose and she had very flared nostrils. Did she do that?
Yeah. I mean, anyone who has, the problem is when you're like Latina or African-American or Korean, it really is necessary. It works really well. But if you are just a regular old Caucasian person, they're doing it all over the place. Why? Because it gives that Instagram model-y sort of super slender look. The problem is it looks crazy. Your nose looks clipped, pinched. And then your nostrils have no more curve to them, no flare to them. And a little bit of flare is normal. And so one of the things that affected Michael Jackson is that, he kept clipping them until they got so narrow that they were like just stuck to his nose. So once that happens, you own it. There's no fixing it. There's no revising it. There's no going back. There's no adding to it. And the thing is, it's not only about that, but remember, you're clipping two nostrils and then sewing them back. What if you sew one a little higher? What if you sew one a little more in? It's really difficult to get this right. So this is one area where people can easily tell from 100 miles away you had your nose done. And people take it very lightly because the surgeon's like, oh, no, don't worry. I'm just going to narrow your nostrils. What? How are you going to narrow them? Oh, I'm just going to cut on the outside and sew them together. So caution to you on that. So that's the front exam. Bone, middle vault, tip, and nostrils. We'll take a break. We'll come back and I'll continue on the exam and then we'll talk about recovery and risks and all that good stuff. But we're definitely going to point out to you all the areas that you need to be careful so that you end up not having a catastrophe with your nose. All right. Join us in a little bit. We'll be back at the break and continuing on with Rhinoplasty 101. All right, welcome back to Plastic Surgery Uncensored, our second half of Rhinoplasty 101. I'm super excited. I've been joined here with Maria, my producer extraordinaire, and we're kind of just going to chug along through rhinoplasty. I'm giving you all the trade secrets of how to stay clear of a catastrophe, what to ask for and what to know. So we're on the exam portion of knowing about noses. We talked about the front view, and now we're going to shift gear to the dreaded profile. Probably 70% of people who come in complain about profiles, 25%, 30% the front. So what are the issues with the profile? Number one, I got a dorsal hump, a huge bump. My nose is too projecting. It sticks out too far. Easy breezy. So what we want to do is we want to reduce that. Where do you run into trouble? Someone goes and reduces your hump, and all of a sudden you got this super scooped, ski slope, fake looking nose. Disaster. That happens all the time. Girls, guys, I mean, in a guy, it's over. If you have a scoop nose as a guy that is not natural, especially if you're ethnic, Middle Eastern, whatever, it looks ridiculous. So what is crucial about a natural nose is it looking like it belongs to you. And if you have all these dark features and then you have this super scoop nose, it's going to look silly. So I am very careful with reduction of the bridge. Yes, you want to reduce the hump and make it look, if you're a girl, feminine, but I am vehemently opposed to over scooping a nose. It's my aesthetic. I don't like it. So we definitely want to shave down the bone and the cartilage and then create a softer profile. Next, we talk about tip projection. So your bridge is now brought down, but then your tip is an issue. So there are two things that happen with tips. Most people, their tip is droopy. It doesn't have projection. It's like downward turned. And then, of course, when you smile, it works worse. Very seldom, but sometimes people's tips are too projecting. Their nose is way too far out. In those instances, you want to set them back. The more common is that your nose is droopy. And so that has two problems. One is your nose is pointing down, and the other is your nose isn't pointing forward. So you want to rotate, bring it up, and project the tip so that it ends up at the end of your nose, not at the bottom of your nose. Where do you run into troubles here? Piggy nose. Surgeons will over-rotate. So now, issue one is you have a big scoop nose. Two is your tip has been brought up like a pig. You couldn't put the two of those together. Now you have a ski slope piggy nose, and that's all over Instagram.
Yeah, you see that, believe it or not, in a lot of these soap operas in Mexico, the soap opera stars, their nose is like this. It's like a little tip up, and it seems like was in fashion in the 90s in Mexico because every star in Mexico has that nose, and it looks horrible.
Yeah. And it's quite common because it's effortless. So let me tell you how people get there. Part of it is, I don't know that too many people ask for it. I think there's an occasional, I mean, I've been in practice for 15 plus years. Maybe because people go to my gallery, they don't see that. So only the people I get are people who want so-called natural noses. Every once in a while, a girl will ask for it, but usually it happens out of error. You've removed too much from the hump and you kind of were left with a scoop, and then you rotated the tip and you overdid it. It actually takes less effort to do those two items because it's overdone. Overdoing is easy. Underdoing requires skill. You understand? That's like shooting a basketball. It's easy to overshoot. You just hurl the ball over, but it's much harder to get it accurate. And so what you want to do with noses, you want to bring the bridge down and rotate the tip, but in a way that overall looks like, oh, wow, that girl looks pretty hot. He's a handsome dude. But over-rotating the tip is everywhere. I mean, geez, it's like not only just Mexico, Iran, oh my God. I mean, they're pumping these out like nothing. Now imagine a really pretty Middle Eastern girl with thick eyebrows, dark eyes, with a headgear or a shawl around her head, and then this pointy little bird beak nose. I mean, couldn't be more unnatural, and it's everywhere. So that's the second thing.
Can I ask you something? How do you know that you haven't overdone it? If you're in the middle of the surgery, you're not actually seeing the nose in place. It's open, right? So how do you know that
you're positioning the cartilage and then you're temporarily redraping the skin and looking at it. Okay, when I do a nose, I don't just like put a few stitches in and call it a day. I put it and then I redrape the skin over it. And then I get to the side and I'm like, I don't like that. That's a little overdone. I take the stitches out. I re-rotate it. It's a step-by-step fashion. And remember, noses are a house of cards. You do step one, then step two, then step three, then step four, then step five. Each of them is dependent on the one before. At step five, you look at the nose and you go, this doesn't look right. Which step was it? Was it one or two or three or four or five that set you off track? So it's like going on a trail in the forest and going to each fork in the road and going left, then right, then left, then left, then right, then left. And then you don't end up where you need to end up. Which fork did you take what was wrong? That's why it's difficult, because every step depends on the one before it. And then when you're off track, then you're just screwed. So that's your side view. Then we'll switch over and we're going to look at the worm's view. That is from the base. It's a view that most people don't care about, nor they see, because unless you're super tall, no one's really looking underneath your nose. But where it's important is that it tells you about asymmetry. People always talk, my nose is crooked. My nose is crooked. It's not centered. Well, let me tell you something, folks. Your nose will always be crooked. Every nose is crooked. Every nose, every celebrity, every supermodel, everyone is crooked except for Photoshop model photos. But the question is, how crooked? When you come in and your nose is going like totally to the right, that's fixable. You can make that so much better. When your nostrils are like totally off, you can make that better. But when your nose is mildly canted to the right or gently to the left, or one nostril is slightly higher than the other, there's no way anyone's going to make that symmetrical. Surgeons will say, yeah, no problem, I'll fix it. It's impossible, because at the end of the day, it always has some asymmetry. Where the base view, I use it for is I take a photo and I show them how screwed up their nostrils are. No, who the hell has taken a photo underneath your nose? Nobody. And then I say, look, you see how your nostrils are so asymmetric? And they're like, uh-huh. I said, it'll be asymmetric when I'm done. There's no way your nostrils are going to match. Never. And then they get it. I mean, they'll be better. There's no reason for them to be significantly off, but they're never going to be perfect. And you can also see the flaring from underneath as well. And the last part of the exam, and really critical and totally overlooked, is the inside of the nose. I examine the nose. So a lot of things, what happen is, so noses are divided into the cosmetics and the function. The function is, I breathe well, I can move air, my nose doesn't drip, right? Beauty is, oh, it looks good, it looks balanced. Usually you think about breathing with your ENT, your ear, nose, and throat doctor. Usually you think about pretty and attractive and plastic surgeons. The problem is when you go to an ENT, often they do the breathing part and you say, yeah, well, I'm here. Could you just shave a little off my bridge and fix my tip a little? I'm like, sure. And they do, I'm sorry, a shitty job, because your cosmetic became an orphan. It was just a side thing, like while I'm there. Conversely, you go to your cosmetic plastic surgeon. You're there. You're like, hey, I want to make my nose look prettier. Oh, by the way, I can't really breathe that well. Yeah, we'll fix your breathing. And what happens? Your nose looks great, and then you can't breathe 10 times worse. You can't run, you can't bike, you can't get on a treadmill. Every single rhinoplasty I do functional and cosmetic rhinoplasty. Everyone, whether you complain of breathing or not. Because remember, if your breathing is great and you have a cosmetic rhinoplasty, your breathing will be what? Worse.
Oh, it'll be worse.
Yeah, because you're taking 9 out of 10 rhinoplasties are about making the nose smaller.
Oh.
Okay. You go in and you make the nose 12% smaller, 22% smaller. Nobody goes in. It's seldom you go and make your nose much bigger. So breathing is about moving air. It's physics. A smaller nose moves air less well. So if nothing changes, nothing, your breathing is not even touched, but your nose is now prettier and or smaller, your breathing will be worse. So by definition, your doctor needs to do something to your breathing just to keep it the same. Hence why every rhinoplasty, I do breathing work, whether you're complaining or not.
So in the case of someone that has, like you mentioned, 6 dogs and he or she has problems breathing, would you still do the operation on them?
I just tell them how much. Listen, your breathing is divided into parts that are like functional, like every single human being that has seen another doctor comes to me and says, I have a deviated septum. Oh my God, the doctor told me I have a deviated septum. So what? Every human being has a deviated septum. You have one, whoever's listening, everyone who's listening has a deviated septum. That means that when you look inside the nose, the septum, the part that separates the right and left part is not straight. Whose nose is straight inside? It's never straight. What matters is it's so crooked that it affects your breathing, meaning one side is completely closed, or is it so crooked that it affects the cosmetics? My nose completely goes to the right because the septum is deviated. Otherwise, who gives a shit? But doctors will tell you it's deviated because that's a buzzword. You go, oh my God, it's deviated. I have to fix it. And you give yourself a pass. Listen, I had to do my nose job because, well, frankly, my nose was deviated. And so it was deviated. And so I had to do it. While I was there, he did it. That gives you a pass and gives him a pass. But that gets you in trouble. So when I do a rhinoplasty, I check your septum. Always it's deviated. The question is how much? And always your turbinates, those are the humidifiers, are inflamed because we live in cities and we have dogs and we have smoke and we have shit in the air. So every single rhinoplasty I do a septoplasty and I reduce the turbinates, period. So the question is, why are you doing a septoplasty in everybody? And as I said, there are 2 reasons. And I want everyone to listen because this is critical. Number one is I told you that your breathing will get worse after a rhinoplasty, no matter how good it is, because we're going to make your nose narrower. So I do the septoplasty if for no reason less to keep your breathing the same. It's a preemptive surgery to maintain your breathing. Okay, I got that. The second and the more important reason why I do a septoplasty is the following. I need your cartilage. I'm going to repeat that. I need the septal cartilage. The reason being is there are two ways generally to do rhinoplasties. There is the traditional approach and the new, in my opinion, modern advanced approach. The traditional approach, and by traditional is it's being done every day all over the world, is a reductive rhinoplasty. Reductive rhinoplasty. What does that mean? It means that you go in and you say, my nose is big, it's large, it doesn't fit my face, blah, blah, blah. And your surgeon reduces your nose, makes it smaller, cuter, blah, blah, blah. All of the steps are generally towards removing things, removing cartilage from your tip, removing bone, breaking bone, suturing. What happens to a structure when you remove parts of it? Maria, what happens to the Golden Gate Bridge? Someone says the bridge is way too big. It's way too big, this bridge. We're going to remove 14 cables. Your house is way too big. We're going to go into the basement and remove a few columns. What's going to happen to this bridge in the house over time?
It'll collapse.
Of course. It may not collapse now, but with an earthquake or strong wind. So when you look at celebrities, because they're the easiest people to see, and you look at their noses on their IMDb and you follow them over the years. I use Bella Hadid in my office every single day to prove this point. Their noses start looking weirder and pinched, and the nostrils go in, and that collapsing is over time because they had a reductive rhinoplasty. Their nose was made smaller and weaker, and it doesn't hold up over 25, 30, 40, 50 years. Mm-hmm. Nowadays, if you do a lot of noses and you're advanced and you're well-read, you do what's called reconstructive or structural rhinoplasty. What does that mean? It means you make the nose smaller and cuter and all the things that you wanted, but everywhere you went in and weakened the nose and remove something, you must then support it with some rebar or some T-bar or some structure. If I go into a home and I knock out a wall, I have to support the ceiling. The ceiling will collapse. So I put some structure there. And what is that structure? It's cartilage. Where the hell do I get the cartilage? From your septum. You see what I'm talking about? Mm-hmm. I take the septum, you breathe the same and or better, and then I recycle that cartilage, the septum, and I make grafts from it. Grafts are little pieces of cartilage that I hide underneath the nose, and I support the nostrils, the tip, your projection. All the things that I did to your nose, I keep them there with structure. This technique keeps your nose looking the way it did from day one, longer and better. Why do people not do this all the time? Because it is 10 times more difficult. It takes more time in the operating room. A reductive rhinoplasty you do in a jiffy, an hour and 15 minutes. There are guys in Iran who, on their Instagram, they put, oh, look at this. I did 8 noses in a day. Do you know what that means? 8 noses? That's insane. Because they do them
It's a conveyor belt.
Yeah, it's like an assembly line, exactly. So they do them quick and fast, usually close, not always. They bing, bang, boom, you're out. Bing, bang, boom, you're out. A reconstructive rhinoplasty, in the best of hands, usually takes at least 2.5 to 3.5 hours. It's significantly more time consuming. So it's very important. I mean, this is probably the most important thing I've said to you today, is that whoever does your nose, in my humble opinion, should be using more advanced techniques, using support in the nostrils, support in the tip, etc. So that is why I need your septum. So what happens if you call my office and you're like, hey, I had a septoplasty 5 years ago and I want my nose done cosmetically. I got to go get cartilage from somewhere. Where the hell are you going to get the cartilage?
Your ear.
From your ear.
I learned, I remember.
See, you're learning something, Maria. Or your rib. My rib? What the hell are you talking about? Yeah, your rib. I go in the chest plate and I get a little piece of cartilage from your rib. The ear and rib are completely different, and neither of them are excellent. The ear is floppy and curved. The rib is thick and hard. And the best cartilage in the universe is your septum. So if it's not there, it definitely is not as ideal. So I tell patients, if you're going to go get your breathing done, don't do it until you figure out if you want to do your cosmetics. So that is really like some of the most important elements is what I refer to structural or reconstructive versus reductive. Now let's shift gears. Excellent. Okay. This part will fly through. What's the recovery from this? Like, oh my God, I've looked online. People look like a truck hit them. Pain, minimal to zero. Breast aug, painful as shit. Liposuction, painful. Rhinoplasty, minimal to no pain. When can I go back to my job? Usually 2 weeks. You have a cast on for about a week. You have some tape on for another week. You can Zoom probably within 2 days. When can I go to the gym and exercise? I'm really strict. Technically, surgeons will let you go usually around 2-3 weeks. I say 4 to 6 weeks. Okay, what are my follow-ups? How often do I need to come and see the doctor? 1 week, 2 week, 6 week, 9 months, 2 years, 3 years, 5 years, 10 years. Let me repeat that. 10 years of follow-up. Why the hell would I go see my doctor for 10 years? I don't do that for my breast aug. I don't do that for my facelift. I don't do that for my eyelids. Noses are a unique animal. They're unlike any other part of your body. When you get a rhinoplasty, you shouldn't even blink an eyelash for 12 to 18 months. It takes 12 to 18 months for 80% of the swelling to go away. So I hate my nose. I love my nose. You can't even begin to decide for 12 to 18 months because it takes that long for the swelling to go out of the tip and all those things. So when a surgeon says to you, oh, when you go to see a doctor for a revision, they should never touch your nose for at least a year because they don't even know what's going on.
And doesn't the nose always continuously grow a little bit?
It's not so much it grows, but it continuously changes, just like your earlobes, just like your eyelids. I mean, the reality is that everything changes. If you go look at your photo from 20 to 30 to 40 to 50, nothing else, look at the distance between your lip and your nose. It grew. Mm-hmm. If you look at your same period of time and look at your eyebrows, they sagged. So of course your nose is going to change, whether you had a rhinoplasty or not. So if someone's going to do your nose and then you're never going to see them again, good luck, right? I mean, it's a surgeon's dream for you to never come back, but you should be seeing them at least a few times. The surgery in my hands takes 3 hours, not 1 hour. When a surgeon tells you you'll be in and out in an hour, I guarantee you're going to get an hour's worth of attention. So pay attention. I do it under general anesthesia. I do it with my team of anesthesiologists. I don't cut corners. I don't like to do it under local. I don't like to do it under conscious sedation. Each person does it their way. For me, I like you under controlled environments. So the last part of this discussion is, what are my risks? Risks. This is, oh God, I'm afraid of something going terribly wrong. So here are the risks. Bleeding, very rare. Infections, even more rare. Scars. If you do it open, it's a tiny little scar at the base of your nose. It should heal if closed correctly. That's the key. If they close like shit, it's going to look like shit. But if it's closed well, it's really, really, really blessed area. It heals well within a week. Difficulty breathing. I can't go read reviews. There must be thousands of reviews about people who went in for cosmetic rhinoplasty and can't breathe for shit. So your surgeon must be paying attention to your breathing and make sure that it's not an orphan or an afterthought. So what is the main risk with rhinoplasty? This is the main risk. I say irregularities, asymmetry, contour deformity. Irregularities, asymmetry, contour deformity. I have no idea what that means, Dr. Rahban. It means your nose will not be perfect. That's it. This is the thing that's one of my biggest pet peeves. Most people who go see a rhinoplasty consult, the consult is done in like 20 minutes. You go in, you give them some descriptive, my nose is big, it's not feminine, it doesn't look cute, whatever. They nod their head. They take a picture of you. We put it on a monitor and we do what? Photoshop. We Photoshop your nose. We photomorph it. We bring the bridge down. We bring the tip up. We narrow the nostrils. You go, oh my God, that looks terrible. They bring it down. They bring it up. You bring it forward. You bring it back. You do whatever the hell you want until what?
Till you get what you want.
Till you get what you want. Wow, that looks so good. Oh my God. And you love it. And then they print it out and they give it to you. That's the consult. And what does it say on the bottom? It says before and after. There's always usually a really nice logo in the upper right-hand corner, whatever the office logo is.
And they put a disclaimer on the bottom.
And there's a massive disclaimer.
Yeah.
What does it say, Maria? What's the disclaimer?
It usually says something like, it's not, in other words, I can't remember.
Results may
differ.
Yeah.
It may vary, be different. That's it.
They all say results may vary. What the hell does that mean?
Everybody's skin is different. Everybody's nose is different.
What it means is that you will not look like this after photo.
Mm-hmm. Yeah.
What? Hold on a second. So I came in, I told you I don't like my nose. We went through all these gymnastics. You gave me this stunning nose for me. And then you're telling me I won't look like it? Would you ever hire an architect who gave you plans to building a home, and then in the bottom of the architectural plan say results may vary? Your house may look like this.
No, you don't want to go with that.
No, right? You wouldn't. So
No.
if results may vary, what does that? It means you are not going to look like this. So naturally, you should ask one simple question. Why on earth are you giving this to me then? Very, very simple.
To entice you.
The only thing that prevents anyone in the world from doing their nose, there's only one thing. Believe me, it is not the money, because if you have no money, you save it.
Mm-hmm.
It is not the time off work or school or recovery, because you'll get time off. It is fear. Fear of what? Fear of looking like a pig, like a Pinocchio, like that friend of yours from college, like that crazy aunt of yours, looking like a weirdo. Everyone is afraid of their results being terrible, and that prevents them from ever doing their nose.
Yeah, smack in the middle of their face.
So therefore, as surgeons, what is our number one goal? To book you. We want your money. You are a prospective patient. I want to operate on you. So in order to get you to do your surgery, what do I have to do?
You have to win it over.
Overcome your fear.
Mm-hmm.
I don't know, what am I going to look like? I just can't imagine. So what do? I do a photomorph. I make you a photo. I make you look like exactly what you want. And then I put a disclaimer that you won't look like it. You go do your nose, you come out, you don't look like it. You're devastated. What do I tell you? I told you you're not going to look like this. So it's a booking tool. It's a closer. It's what we use in the industry to close the gap and get you to book. I have never, ever used Photoshop or Photomorph. Anyone who knows me knows I love photography. Love. And I can photomorph like the best of them. But it's incredibly misleading and very disingenuous. Mm-hmm. So what I tell patients, so this is the last part that you're going to hear of this consult. No matter where you go, who you select, when you do your nose, if your current nose is on the left hand and your amazing Photoshop perfect nose is on your right hand, wherever you go, whoever does your nose, you will end up somewhere in the middle. Now, the reason one does their nose is because they want to be happy. Not because they want to be a model, not because they're looking to be an Instagram famous person, because they want to be happy. For you to be happy, you need to be reasonable. Reasonable means what? You need to look at your existing nose and your done nose, which is better but not perfect, and say, wow, this looks so much better. You know, Dr. Rahban, I'm happy. Wow, I can now take photos without worrying. I can stand to the side of people and not worry if they're looking at my nose. I can finally put my hair in a ponytail. If you are reasonable, you'll be happy. If you are a nitpicky person, I am the most nitpicky person in the world. If you're a critical human being, you will come back to your surgeon guaranteed and say, listen, yeah, my nose is better. Of course it's better, but you see this part of my nostril over here? Wait, let me show you this photo. I take this angle, and whenever the light is, if you're that person and you're critical, do not do your nose under any circumstances with any surgeon anywhere in the world. Save yourself a ton of money and a lot of agony, and do your surgeon a favor. You will never be happy, and you will waste your money because it will always be flawed, and you'll always find that flaw. I would never get my nose done. I'm the worst candidate in the entire planet because I will 100% laser focus on what isn't right, not what is right. You know yourself. Don't bullshit yourself. If you're critical, stay the hell away from surgeons in general. So most surgeries that I do what's an open rhinoplasty, a septoplasty, and I reduce the turbinates for breathing purposes. So I hope you guys have really listened carefully. This is, in my opinion, everything, and I mean everything you need to know in order to steer in the direction of a better outcome. Notice I said better, not perfect.
Can I ask you a question regarding the visits? You say you have visits almost 10 years after the fact. Have you ever found that you've had to do a revision after so many years, or what is the point of the revision? Just to see how it's progressing, or
great question.
Something would happen?
Great question. So naturally people are going to say, oh, so every surgery in the world, facelift, eyelids, breast aug, tummy tuck, has issues, and every one of them have revisions. The question then becomes is, what is the revision rate? How often are you revising? And believe it or not, when you read online, the revision rate for rhinoplasty is a staggering 20%. That is insane. Not breast, not lipo. And why that is it's very difficult surgery to do. 1, 2, people are critical. And 3, there are a lot of unknown factors, which is the healing and scar tissue. So you already have a high risk of a revision rate, let alone not doing your homework. The reason I see the patients is because I need to learn. How did I learn how to do rhinoplasty? I learned it. I wasn't just born with it. I didn't just get up one day and finish graduation and then just pow. It's the practice of medicine. Yes, your surgeon is practicing. The first year, the 10th year, the 20th year, the 40th year, they're practicing. They're getting better, just like a police officer and a pilot and everybody else. So you cannot get better if you give a shit. If you do a nose job and you have no idea whether or not, a perfect example, you cook, you make cakes. You've never tasted your own cake. How the hell do you know that your cake recipe is good? You don't. You have to eat your cake. Oh, wow, this tastes like shit. Oh my God, this is terrible. Because you as a rhinoplasty surgeon, you do a bunch of noses, you see them up until 2 months, and then you wish them well. That's like sticking your finger in a cake after 16 minutes in the oven. You cannot tell whether or not what you're doing, all the maneuvers have worked or not for at least a year, if not 2. I want them back because I have got to push the envelope in my progress as a surgeon. For example, I don't do anything that I used to do 15 years ago. Nothing. I am 1,000 times better and I will get 1,000 times better. But I can't do that if I don't see that what I did. It's like planting 1,000 seeds in a garden and never coming back to see how they grew. You just plant seeds and you go on to the next garden. What kind of gardener are you? So you need to see the results. That's number 1. Number 2 is inevitably shit changes. And of course I do revisions. I'm blessed in that I believe that my revision rate is a fraction of that of other people, but by no means is my revision rate 0. With every effort, with every intention, things are going to go not exactly as you planned. But thank God I don't have like catastrophic issues. And if a patient is reasonable, I want them to be happy. So we'll do a revision. I have patients coming into me, Maria, I swear to God, this is my 5th rhinoplasty. I'm not touching you.
Oh my God.
Every single revision you do, the nose becomes 10 times more difficult. You're on your 3rd breast revision, it's more difficult. You're on your 2nd tummy tuck, it's more difficult. You're on your 3rd rhinoplasty, impossible. The scar tissue that forms, the cartilage gets destroyed. I almost don't even see, I have everyone who wants a revision send in photos. I don't want to waste their time because, people think they're heroes and they go in there, oh, that last surgeon was an idiot.
But also if they've had 5 revisions, it means that there's something wrong, that they haven't been satisfied 5 times.
No. I don't blame I don't blame the patients. Many, many times the surgery went wrong. Okay. Mm-hmm. The surgeon who did it says, listen, I'm so sorry. Let me fix it. That's the error number 1, because you already paid the money. The guy's sorry. He wants to fix it. The idiot did it wrong. He did it again wrong. Now you're 2 down. And then you finally go to somebody else and that person is working behind the 8 ball. It's not revisions seldom are because the patients are crazy and they want this perfect nose. Yeah, I have those people.
Except sometimes they're picky.
Nah, it's seldom the case. It's usually something went wrong and then something went 10 times wrong and then something went 100 times wrong. Why am I underscoring do it right the first time? It's not like other things where you can go back. If you can't afford a great surgeon, don't do it. Wait 2 more years. Save $100 a month. $100 a month, 3 years later, you can afford the surgeon you like. It's not worth it. I can't tell you how impossibly difficult a revision is compared to a primary nose. So this is I'm giving you my everything I know about noses. This really is Rhinoplasty 101. I genuinely believe from the bottom of my heart, if you pay attention to this, you should be able to steer not into perfection or have a great outcome, but certainly know what to ask and where to be and have a better likelihood of a good outcome. I hope you guys enjoyed this as much as I did. And as always, Maria, we look forward to having you guys listen into our next episode of Plastic Surgery Uncensored. I'm sure whatever we're talking about will be interesting and exciting.
Thank you for listening to Plastic Surgery Uncensored with Dr. Rady Rahban. We would love your feedback. If you enjoyed this episode or if you find our podcast helpful, tell us why. Leave us a review and make sure you subscribe on your favorite podcast platform. If you have a topic you would like for us to discuss in an upcoming episode, please reach out to us on Instagram at Dr. Rady Rahban, on Facebook at Rady Rahban, or at RadyRahban.com.